Welcome, welcome to this month's Ask Dr. Kristina. We are talking about one of my favorite subjects, and there are so many things to talk about digestion. And I feel like in this day and age, it seems to me that every single patient I have, from my anxiety sufferers to my autoimmune sufferers to my patients with depression, it seems like the digestive piece has always been there or is always a factor, but it's not been recognized. That being said, I feel like the number of digestive disorders I've seen in the last 5, 6 years is unbelievable. So, one of the things I wanted to really talk about today is really the digestion 101, breaking the digestive roller coaster. You know, so many people come in and say to me, I've tried everything. I'm like, well, have you tried this thing? Well, I haven't tried that thing. I've seen all these specialists. And so, this is a really like first step to understanding your digestive system, where breaks in your digestive system may occur, and how to heal your IBS or your IBD symptoms when you've tried everything. And to me, when someone says they have irritable bowel symptoms, I just ask them, do you want to know and figure out what's irritating your bowel? Because that's really, it's a message from your body. And your body is sharing this message with you for you to listen and stop doing. Usually it's more than one factor. Stop doing those things to not irritate it. So I'm really excited about this lecture. I hope you have a pen and paper. You can save your questions for the end or put them in the chat, and I'll save them for the end to get to them. But let's go on. So a little bit about me for those of you who are new to here. I have been a chiropractor since 1999. I graduated. I've been practicing functional medicine for about a decade now, and I have worked with moms and kids and families in my community for a long time. We've had a practice. This will be our 26th year in practice with Bosnar Health Open, so I'm really excited about that. When I started to learn more about the intricacies of biochemistry and digestion, and did some clinical training in functional medicine, I was super surprised by how radically you can shift things in a positive and or negative way based on really simple things like the food you choose and how your digestive system is absorbing nutrients from your food that you're chewing. And so I've got an advanced clinical training with Dr. Terry Walls, who is a brilliant, brilliant doctor who has put her MS symptoms not only in remission, but is walking again after being in a wheelchair for many, many years. I've done functional pediatrics as well as learned how to reverse cognitive decline with Dr. Dale Bredesen, also brilliant, brilliant practitioners and mentors. I am especially interested in gut health and autoimmunity and brain health for families and kids. It is one of the first places I start my practice. And seeing the power of food and lifestyle medicine, along with the protocols we use in functional medicine practice, to take chronic conditions like IBD and IBS and chronic constipation and autoimmune diseases and put them into remission was so inspiring to me. And I want to inspire my community to take control of their health. So that's really my mission, is to teach you and the rest of my community how they can listen to the messages their body is sending them and figure it out, so that they can too take control of their healing and live, happier, more vital, less painful, more joyful lives. So I used to have a lot of digestive distress. It's kind of what brought me into functional medicine. I had 3 small kids. I was running around, sleeping with all of them in my bed, so not good quality sleep. I was trying to shove food in my face as I was feeding them, all the organic, incredible, lovely homemade food. I didn't sit down a lot because there was a lot of them. Actually, for years, you could hear me after my last baby saying, "Well, I'm just postpartum," even though it was 2 or 3 years, because I was still bloated. I was still having indigestion. And I was low energy for me and tired. The average person may not have seen that because my energy is pretty high normally, but I felt a bit like a zombie. And I was gassy all the time and uncomfortable. And so I really, looked to functional integrative medicine approaches, and started learning. And when I learned at the Institute for Functional Medicine, this is Dr. Terry Walls, who is one of my mentors. I've done her advanced clinical training in helping reverse autoimmune conditions and things like multiple sclerosis. And this quote of hers is just really so poignant to me. If my MD colleagues do not wake up and begin teaching their patients how to show them how to eat and live for optimal health with gratitude and joy, that profession will be replaced because we are at a tipping point in our communities where we do have to start addressing the power of the food you choose and the way you eat it and how you digest it and your lifestyle choices, the movement and the sleep. Because they're directly linked to, they've shown like a risk for cancer, 70% increased risk for cancer, 80% increased risk for heart disease, and 90% of the risk for diabetes. And these can all be powerfully changed with food and lifestyle, which is why I love doing these seminars for people, because this is just really good information for people to know so you can take control, one day at a time, one tiny step at a time. Um, and help yourself heal yourself and get to understand how your body works and understand what is your body trying to tell you when you have some gas or you have some bloating or you have those irritable bowel symptoms like blood in your stool. Those are all really important things. So, what am I going to cover today? I'm going to cover the basics, nutrient density in our food and why it's vital for healing, why what you choose is really, really important. Um, the different signs and symptoms I see when someone's having digestive dysfunction, some of them are very obvious and will be very obvious to you, and some of them you'll be like, oh, I didn't realize that was a sign of digestive dysfunction. I will teach you a very small course in optimal digestion, how digestion actually works from the start of when you start putting it in your mouth till you evacuate it out of your rectum. And then my personal solutions, the four C's, very easy things to implement. And actually, I've had patients, many patients over the years, and given them this advice and have seen great changes and radical shifts in their digestive health just from small, small changes. So don't underestimate those small changes because they are incredibly powerful. So, what are symptoms to look for when someone has poor digestion? And these are the ones we commonly see in the practice, in our functional medicine practice, when I am starting to work with someone who has some sort of digestive distress that's linked to either autoimmune condition or their mental health, or even just like their physical health. Inability to finish a normal size meal. So having like a normal size plate, and that's kind of normal is kind of relative, but an average amount of calories in a day, inability to finish a normal sized meal and having to eat small little meals is a problem. Like not able to eat a meal so that you can last 3 hours and you have to eat every hour or so because you're hungry means there's some problem in your digestion. Like burping all the time and flatulence, gas, I often ask patients when they first start with me, like, well, are you gassy? They're like, what's just the normal amount of gas? There's actually no normal amount of gas. Like burping, unless you've just drunken a bubbly drink, isn't normal. Burping after eating. These things are not like these are signs from your body. And flatulence daily, having lots of smelly gas means you're not digesting things, you're eating something that's irritating your body. It may be great for your kid or your spouse or your friend, but perhaps eating something like a red pepper. Let's say, for example, I had a patient who had a lot of gas from red pepper. Even though it's like very full of nutrients, it was not good for their digestive tract. After quite a bit of healing, he was able to reintroduce it in small amounts, but not every food is good for every person. So really listening to your body when you have some smelly gas or painful gas, that's a sign that something is up with your digestion. And burping after every meal is not normal. And it's also not just annoying, it's a sign of, low stomach acid sometimes. So really understanding these symptoms. Burning under your sternum after meals, or sometimes we call it reflux or GERD. That's not normal either. Just to say, yeah, yeah, I get that little bit of reflux, everyone gets, that's not normal. That's also a sign that there are some parts of your digestive system that aren't working. Having to unbutton your pants like a half an hour after you've eaten, getting a lot of bloating an hour after you've eaten, even if it's healthy food, these are all signs that your digestion is not off. Pain and pressure in your abdomen and bowels. That's also, that something's off. And sometimes people say, well, it's my anxiety. But what people don't understand is that your mental health is controlled by your gut health. So the digestion messages that your body's sending you are real messages that, you have to pay attention and see what's wrong. If you have a child, I always try and put this for children as well. Parents, if your child is complaining about tummy aches all the time, it's not just a nervous tummy. There's something that's bothering them. Kids don't like to complain. And if they're looking for attention, there's a reason why. So really delve into it. What a lot of people don't know also in this left-hand corner is poor digestion also looks like frequent infections. Getting infections all the time means maybe your biochemistry, your nutritional values, your nutrients that you're taking in are not supporting your immune system well enough. Low mood, low vitamin D has been linked to low mood. And in the country I live in, at least in Canada, we don't get a lot of vitamin D. So making sure that our vitamin D levels are at the right place is really important for I'm just gonna, looks like my internet is not stable. It's really important for making sure that our moods are and our neurotransmitters are working well. Let me just make sure I connect this. Okay, just make sure that we don't lose you guys. Um, Skin conditions like eczema and acne are actually reactions to food. Eczema is usually inflammation in that gut lining, so it's really important to look at that. It's a reaction to a food sometimes. It's a low gut immune system function can create eczema, type 2 diabetes, brain fog, especially after you eat, not normal. Could be common for you, but it's not a normal thing to occur. Lack of focus. Craving sugar all the time also can be digestive issue. And then autoimmune conditions we know are related to inflammation in the gut lining and permeability in the gut lining. So these are also indicators of poor digestion. I'm just going to see if I can hook us up here. Hopefully I don't lose you guys. Let me just make sure. Okay. Okay, so when are these symptoms normal? When are some of these symptoms we talked about normal? So if you've eaten too much, you're going to feel like you have to unbutton your pants. These we know when we've eaten too much, we've kind of gone to like a family gathering or a party, and we've eaten things maybe we don't normally eat, and we've eaten a lot of them. If you had a lot of bubbly drinks, having some pain under your sternum or burping a lot will be normal. If you drink or eat really fast, you're going to feel kind of sleepy because it's you just put a whole bunch of stuff in your body, and your body's not able to digest it. And if you eat food that you can't digest, not everyone can digest everything. So if I eat gluten, I'm very, very sleepy, like a half an hour later at the most. So I know that, it's not a food I should be eating. That's the message my body's telling me. I don't like when you do this. It's really hard on me. One of the misconceptions is that the symptoms of bloating and indigestion, are normal, that these are normal. But you're not supposed to be having bloating and indigestion like on a daily basis or like every other day. That is not normal. When you see your kid, like this kid here, I've had a lot of little kids come into the practice and their bellies are distended and they're not overweight. Their bellies are distended. And it's usually a sign that there's some bacterial overgrowth, something creating gas in there that's making their tummies hard. And like I said earlier, that can really affect their mood. With kids, it's like very easy to see if it's their mood. So these symptoms may be common in your house, maybe for you, maybe for someone else, maybe for your best friend. She has to run to the toilet and she knows where the toilet is when she goes out because she has that irritable bowel, but it's not normal. And it really is something that your body's trying to tell you. So sometimes these are more serious things. So, warning signals like when you're really full during your meal, you haven't finished it. When you're waking up bloated, that's not a good sign. We last year had a patient who was bloating even in the morning after not eating, like even doing some intermittent fasting, so not eating like past 7 and was really bloated. And it was one of the things that really signaled me like, you know what, I have to send her back to her primary care physician. And they found she had some tumors. So like it's very important if just recently I had a patient who has always been regular in their life in the last year, like in their 70s, always regular with bowel movements in the last year and a half, not regular at all. One of those people that, go to the bathroom after each meal. And they found, you know, a carcinoma in their stomach. So this is really important that if it's abnormal for you and you haven't eaten a lot, you have to look at it. Going to the bathroom right after you eat can give you a lot of issues because you're not absorbing anything, so you have a malabsorption. Very foul, smelly gas all the time is also a warning sign. When you eat healthy, I have lots of patients who are very well educated in functional medicine, very well educated in good diet and lifestyle. And they're like, I eat really healthy foods like salads and raw veggies, and I actually feel worse and I'm more bloated. There is an answer for that too. And if you're immediately tired after eating, that's a warning sign that you probably have some insulin resistance. Um, One of my mentors, the brilliant Dr. Datis Karazian, taught us that, when you eat and you're hungry and you eat, the only thing that should happen is that you're not hungry. You shouldn't be tired. It means something you're eating is not, your digestion is off because you're tired as soon as you eat. And you also shouldn't be like revitalized. It means your blood sugar wasn't stable. So you shouldn't be tired or revitalized after you eat. You should really just not be hungry. Okay, so how does dysfunction occur? Like what happens here? And so here are the things that we typically see in our brain, in our practice. I'm looking at this brain and eating on the go. So eating on the go means you're not looking at your food, you're not smelling your food, you're not chewing your food, you're like just rushing. And I have kids that do a lot of sports. I have a lot of patients whose kids are like in the back of the car, going from school to like the hockey arena or to the gymnastics arena, or in our case, the volleyball, maybe field hockey. And so they're in the car eating. And so it's really important, if you are that person that has to eat on the go, that you make time to sit still. If you're not the one driving, it's a lot easier. If you're the one driving, I would wait till you stop. But because if you're not looking at your food, you're already missing a portion of digestion, which I'll show you later in this webinar. You need to be in that parasympathetic part of your nervous system where the nerves that go to the digestive organs, the salivary glands, the vagus nerve for digestion, they are turned on. If you are rushing and moving, your sympathetic nervous system, the part of your nervous system that's for fight or flight and go, 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 is turned on higher, and it will shut down your digestion. So you're not even this beautiful organic salad, sandwich, nutball, anything that you made. If you're eating it in that sympathetic state, that state of your nervous system, you are not paired properly. Your body doesn't know how to turn back onto the parasympathetic if you're eating on the go. So your digestive organs aren't stimulated. So here is one of my strategies in the practice when I'm going from patient to patient and I've got maybe 10 minutes to eat something, what we might call a lunch. I'll take 4 deep breaths in and out really slowly. I'll close my door. I don't have any electronics on. I will look at what I'm eating. I will smell what I'm eating. It feels like 25 minutes, and I swear it's like 3 minutes. And then I've put my nervous system into a parasympathetic state. Sometimes I think about something funny one of my kids have done, or something happy that's happened in my life in the last day or two. And that puts me also into that relaxed parasympathetic state. Number two is low stomach acid. And low stomach acid, low HCl, hypochlorhydria can come from a lot of things. Long-term stress can suppress stomach acid production, different autoimmune diseases, chewing, not chewing. Sometimes when you don't eat protein for a long period of time, your body stops producing as much stomach acid. And often I see H. pylori infections. This is really common in my practice. H. pylori infections, it's a bacteria that lives in your stomach and suppresses low stomach acid, suppresses your stomach acid, which can create a whole host of issues in digestion. And what we see actually in terms of symptoms is low iron for no reason. And this is really common in traditional medicine for women to say, or young girls to say, hey, I've tested, I have low iron. And their doctors say, you just have low iron, take an iron pill. But if you're eating, red meat and eating those heme iron containing foods and you don't have a heavy menstruation, there's no reason to have low iron unless perhaps you're not able to extract the iron from your food or you have a parasitic infection. But again, low iron for no reason is kind of should be inspected. It shouldn't be like you're just low iron. Hair loss, just random hair loss can be a sign of hypochlorhydria. Numbness and tingling in the extremities, fatigue, and even memory loss, because what happens if you don't have stomach acid is you cannot turn on your enzymes for digestion. And as you can't turn on your enzymes for digestion, you are unable to extract the nutrients and you start to have brain issues and cognitive issues because you don't have the nutrients you need. So that's really important to understand. And it's usually missed. Let me just see this. Okay. Let's go to the next page. So pathogens. So this is the thing that we look at in functional medicine. When we have tried the other pieces and we looked at the other pieces, we look for stomach acid production, and then we look for pathogens. And pathogens can be found in the entire digestive tract, from the mouth to the stomach to the large intestine to the small intestine. So H. pylori infections are really, really common for disrupting digestion. Small intestinal bacterial overgrowth or bacterial overgrowth. We also see often, and usually this is complicated by frequent snacking, so your body's not able to digest because it's always busy trying to take in food. Low stomach acid can cause bacterial overgrowth, gallbladder dysfunctions, autoimmune diseases like Crohn's and scleroderma, and then fungal overgrowth. These are the 3 things we see a lot of in terms of pathogens that disrupt digestive dysfunction, which is why we do a lot of functional medicine testing to uncover that. SIBO, small intestinal bacterial overgrowth, and gut dysbiosis, which is imbalance of good and bad bacteria in the gut, are likely responsible for symptoms of irritable bowel syndrome, and they can help guide treatment. This was an article in Frontiers in Medicine, and I always say, like, when you find out what's irritating your bowels, which pathogen, which food, low stomach acid, then you can treat it and you no longer have to give yourself the diagnosis of irritable bowel disease or irritable bowel syndrome. So how does proper digestion work? So this is a Probably much more complex conversation. I'm going to dumb it down a little bit because in the sake of time, I'd love to talk about this. So different phases of digestion. So step one is the cephalic phase, actually the sensory and mental inputs, looking at your food, smelling your food. And probably very few of you know that 30% of digestion takes place in the cephalic phase, in the brain, with those sensory and mental inputs. So looking at your food, smelling it starts 30% of digestion. So earlier we were talking about eating on the go, and for those of you who like to eat and watch TV or like to put a screen in front of your kid to make sure they eat and shovel food in their system, you are literally screwing up their digestive system right from the get-go because their body has no idea. Oh, I'm got to start eating. I got to get myself ready. I got to start secreting saliva. The smells also help us indicates to us, okay, it's time for digestion. The vagal activation of that gastric motility and gastric juice secretions takes place in that cephalic phase. So the smell is linked to the endocrine system, which can signal the different metabolic pathways that we need for hunger and satiety. We have to see the foods, we have to smell the foods. So people, and it's interesting, the research shows that people with irritable bowel syndrome often struggle with taste or smell abnormalities. And so that is where part of the break in their digestive system that's causing their symptoms is happening. Step two is the oral phase. So where we take the food into our mouth. And we have sensors on our tongue that tell our tongue, okay, this is fatty, this is bitter, this is sweet. Our saliva has proteases and amylases to start helping break down the starches. But one of the most important things is that you have to chew your food. You have to decrease the food particles so that we can mix it with mucus and saliva so that we have a greater surface area for the enzyme to digest. And we can begin to chemically break down our carbohydrates and a little bit of our fats in our mouth. So if we are just chewing and swallowing quickly, we are not allowing the proper mastication, not allowing the proper size of food to enter our system. And that can also cause a problem. The number of patients I have, I just tell them, I want you to chew. This week, I want you to sit one meal a day and chew. How many patients and people I tell this to, their bloating is significantly better just by chewing because you don't have teeth anywhere else in your digestive tract. They're only in your mouth. So if you miss this phase, you miss this like whole sensory and chemical stimulating phase for your body to tell your tongue sensors to tell your body, hey, I've got fats in here and I've got carbohydrates in here and I have proteins in here for our body to start secreting the right enzymes. Step three is in the stomach. So the stomach, the most important thing to get from here is that we're mixing the food, the chewed up food, hopefully, with HCl, which is that stomach acid, to form something called chyme. And our digestive glands in our stomach lining that produces HCl will be stimulated by that. The HCl, the stomach acid, will also help sterilize the food coming in so we don't have a lot of pathogens. So sometimes people with low stomach acid, I find often get parasite infections. When we look at their digestion, we look at their stool testing, we see parasites. And it's a more hospitable home for their parasites because we're not able to have that antimicrobial effect of the stomach acid. So the stomach acid is so important. Step one, you can't go to step three without step one. This is where we absorb some fat-soluble substances, and this is where we secrete something called intrinsic factor, which we need for vitamin B12 absorption in the small intestine. So there's other things, ghrelin, histamine, serotonin, and gastrin. They're all produced here, but the most important part is that it's the place where we sterilize and we start to turn on our enzymes for digestion. Step four is in the small intestine, and you can see it's a lot of small intestine. It's the primary digestive organ in the body. It propels the food at a slow rate so that we can absorb and digest. We have lots of different hormones. We have pancreatic juices, bile. The pancreatic juices have the enzymes that break down the proteins and some of the fats. The bile helps with the fat breakdown as well. We have a secretion of a hormone called motility, which accelerates that gastric emptying, stimulates that intestinal peristalsis to move the food down, and we produce pepsin, which is the thing that breaks down our proteins. So the small intestine is where we absorb a lot of carbs and proteins and fats and a lot of our nutrients, vitamins, and minerals here. So earlier I was saying, pathogens like small intestinal bacterial overgrowth can be a root cause of people's digestive issues or if they're IBD or IBS. And the challenge there is because if we are not able to digest in our small intestine because we have a bunch of bacteria that shouldn't be there now that are maybe supposed to be in our large intestine, in our small intestine, then we become nutrient deficient because we can't absorb those nutrients either because there's something in the way. Step five is the large intestine. This is where The trillions of bacteria live. There's good and bad bacteria. There's a good balance. It's called the microbiome. Even though we have a microbiome that starts in our mouth and goes all the way down, this is where we traditionally talk about the gut microbiome, and we test the large intestine in our functional medicine practice to see the different varieties and amounts of good and bad bacteria and make sure they're balanced. This is where we make vitamin K and B vitamins and biotin. We have a little bit of bacteria that helps us with our metabolic processes. I remember Dr. Walls saying, the microbiome is the missing key to health in our generation of sick kids and sick people, and that the microbiome has the keys of life because it runs the biochemistry of life. It helps make our V vitamins and vitamin K. It helps detoxify things. It helps us with our neurotransmitter production. So it's such an important part of digestion. Um, and this is where we eliminate our waste species. So if we are not eliminating, we're constipated and we're not going to the bathroom often, we're also having a buildup of fecal matter, then we're going to have this dysbiotic large intestine that's not going to work very well. It's not going to synthesize these vitamins that we need and these neurotransmitters that we need. So that's a long physiology class there, but what can you do? What can you do knowing that, oh yeah, like you know what? I didn't mention like step one or step two in the stomach. If you burp after you eat, like right away after you eat, that's not normal. That's usually a sign that you have low stomach acid. If you bloat 30 minutes after you eat, that's usually 30 minutes to an hour and a half after you eat. It's usually a sign of small intestinal bacterial overgrowth. If you have a lot of smelly gas, when you eat, it's probably a combination of bad bacteria being overgrown and less of the good bacteria, and probably food that your body doesn't like. So, what can you do today at home and teach your family and your friends who may be complaining of digestive distress? So, I always tell people follow the 4 C's, and these are super simple to remember: choose, chew, chill, and cherish. And step one is always going to be the case. Any advice I give anybody who has any kind of chronic health condition or just wants to be healthier is you have to choose the right food. This is like the first step to avoiding any digestive distress. Highly processed food, packaged food, high sugar food, chemical food too. That's always going to be a disaster for digestion. Some people feel it, some people don't. Some people feel really moody after they eat food that is full of chemicals, ultra processed food. And they don't relate their mood to the food they're eating, but it's super related. So, if you have digestive distress or you're moody, think about when you eat certain things, if it changes. I know with children, it's very easy because they don't have emotional regulation as well. So you can really see that connection. Okay, why is my kid like having a meltdown? Oh, yeah, we had this granola bar after school that maybe had like something in it that didn't work for my kid. So choosing the right food is really important. And my rule of thumb is whole one ingredient foods if you can. So it's like the one ingredient food diet. I always laugh, and people are like, what is that? So the paleo or the keto diet, it's like an avocado, like an olive, a piece of beef, an egg, an orange, just whole foods. The more that you feed yourself whole foods and you chew them, the better it is as step one. There are some times where eating raw whole foods is also problematic, and those are part of those deeper lying functional medicine kind of testing problems like bacterial overgrowth that we look at. But eating whole foods is important. Eating the foods that your body knows, you put it in your mouth and your body's like, oh, I know that's an apple. Always laugh about um, what are they called? Goldfish crackers. So cute, little orange pieces of poison. Your baby puts it into their mouth and their body's like, I have no idea what is this thing? They can't recognize it because it's all chemicals. So really taking the first step to choose the right food is really important. Whatever dietary plan you follow, keto, vegetarian, carnivore, whole foods is the way to start. Step two is to chew your food. This is the second C that I think is probably the most transformational for most people who have bloating. It's like a very amusing thing to me that it's so simple that people forget to do it, but you don't have teeth anywhere else. So chewing is that first vital step. You can't take big chunks and chew, swallow. You are going to get bloated. You are going to have digestive distress. You may get diarrhea from that. We can't break it down. So recommending 10 chews. Okay, so if you have a raspberry, you can't chew it for 10 times. But as soon as it turns into liquid, you've done your job. It does two things. It breaks it down into smaller particles, but it also allows your brain to sense chemically what is in your body so that it can signal the rest of your digestive system to secrete the appropriate enzymes to digest that food. I'm a very fast eater, so I have to put my fork down between bites. It took me a long time to do that. I have to breathe because there's always other things I'd like to get done. And you will find that if you do that, you will take a little longer to eat, but you will probably overeat less, but also have chewed your food and feel better at the end of your meal. Step three, chill. This was that thing we were talking about, eating on the go. 30% of digestion starts in the brain. When you smell it and you see it, it stimulates the organs like salivary glands and other digestive organs. You cannot turn on your vagus nerve to digest your food, and your vagus nerve helps with all sorts of digestive processes. You cannot ask your brain to turn on digestion when you're stressed out. So think of something relaxing if you only have a small period of time to eat. If you have small children and dinner time is very stressful because you're trying to get everyone fed because they're hungry, here is my tip to you. And this is what I had to do by my third kid. Um, I had to eat once they were done. Once they were all done and I could just relax, then I would eat and I would let them kind of digest and play around and I would eat slowly or I would eat before, but I wouldn't eat with them a lot of the time because they like to move a lot. They were busy kids, which I encourage, but it's difficult to eat with them when you're stressed out. And I knew I wasn't doing myself a service. I was bloated often after eating. Step four, cherish. So gratitude has been studied now for decades. And feeling grateful for what you're about to eat puts you in a very receptive state, neurologically, actually, so that not only it improves digestion, it puts you in parasympathetic, but it overall relaxes you, which is a great place to eat. So thankfulness decreases stress almost instantaneously. So maybe if you don't like the whole breath work thing before you eat, maybe you stop and you go, I'm thankful that I made myself a delicious lunch and I get a chance to have a break and eat it, or I'm thankful for my partner or a job that I love, something. One piece will shift you right into that parasympathetic mode and cherishing the food you have and being grateful for the ability to sit down and eat it. It seems like a very tiny step, but I find that when you add these all four together, these tiny little steps, it can have a transformational effect on your digestive system. And it's free, it requires very little time, and you can start doing it today. So relaxing, smelling, chewing, and enjoying your food. Those are my tips, the four C's. So I want to just share with you one story. We have so many stories of digestion. This one was quite complicated. This was an 18-year-old Brian. And before he came for me, he was suffering for over 8 years with chronic stomach pain. Along with that chronic stomach pain, he had severe anxiety. Um, Much to his embarrassment, when he told me he had a lot of pain when urinating, he had chronic constipation and extreme gas pains. He said it used to feel like knives in his stomach. He would have so much pain. His mom brought him to me. He had ADHD, ADD, I'm sorry, and depression, difficulty concentrating, and difficulty with memory, wasn't doing well in school, and even difficulty with judgment. So he was having a lot of problems. But his mom, who was a single mom, was determined to bring him in and see if we could help him at all. And what we found when we did the functional medicine testing, we did a stool and urine test to look for pathogens, to look for enzymes, to look for immune system in the gut. We started with diet and lifestyle strategies before we found out what was wrong with him. And all I said was, because he confided in me that eating with his mother was very stressful because she was very stressed out about him. So I suggested they don't eat together for a period of time because it was stressful. And he started chewing and relaxing when he was eating. And our health coach helped him through, do some visualizations when he was eating. He started having bowel movements after every single meal, which was huge for him. He was chronically constipated, again, being in that nervous system state of stress with his mom kind of picking at him with all the best intentions, as all parents have. um, just implementing chewing and relaxing for those meals was transformational for his bowel movements. We found he had an H. pylori infection, this poor kid. He had small intestinal bacterial overgrowth, which probably came because he had low stomach acid from the H. pylori infection. He had mold. He urinated out mold. This was a hidden toxin that his parent couldn't see, that we were able to uncover. And then in the end, we found out that he had, as we kept digging, he had an autoimmune disease called Sjogren's disease, less saliva, gastroparesis, end up with nutrient deficiencies. So if his mom hadn't really gone down this route and not, she didn't want to accept that his constipation was normal, that he was just a constipated, anxious kid. She really wanted to help him. And the long-term effects of this Sjogren's disease, if you weren't careful and weren't careful about fixing that gut lining and healing it, was blindness and non-Hodgkin's lymphoma. So ignoring your symptoms is not a strategy that we recommend. Following these four C's is a great first step for anyone. You can do it with your kids. You can do it with your family member who you know like wolfs down their food. Talk to them slowly. Put some soft music on to set the stage for relaxation. But these are our first steps we recommend. For those of you who want to look at a little more information, we have a free download called The Six Overlooked Causes of Digestive Disorders, just to give you more information. Some of the stuff we've talked about today, and maybe just a little bit more. And you can find it at drkristinabosnar.com. Share it with someone that you know has digestive distress. My biggest mission is to help as many people as I can with information. I can't see everyone in the office. There's too many of you. So if something in this resonates with you and you know someone with digestive distress, please share it with them so they can do better. Also, oh, I'm not sure. Oh, so this is a special offer. We've just actually put this together. I'm super excited about it because I love to give free advice. I have lots of people who want information, but I don't know their history. And so we have this special nutritional consult. It's a 30-minute private session with me and whoever the patient is, to really help me dig down into your diet and lifestyle based on a questionnaire, on what's hurting you, what to do with next before any of the testing, just changes in food and lifestyle and diet, and some supplement recommendations if you just want to get started. And this is kind of an idea here of what we did with one patient. Dietary considerations of kind of meats and different plants they can eat and detoxifying vegetables. They were worried about dementia and brain focus, and brain function. So we included some of the foods, and they had some fungal overgrowth that they knew they had, some supplement recommendations. So this was just really based to their history, and their specific concerns and their specific goals. It's only $150, 30 minutes. We'll review your current diet and lifestyle information, and then we'll give you a supplement review. If you take supplements, see what's good, what you do and don't need. Maybe you've been taking things for a long time that you don't need. Um, we'll try and identify your key obstacles and your health goals, and then we'll personalize it to you. So it's we haven't done it before. We just started this year. I'm super excited about it. It's a way that you can tap into the functional medicine without doing all the testing, just starting. I actually don't like people to test if they're not eating well, and they're not doing well to start with, because it's a lot of money to spend for testing if you can't even make good choices and have good habits like chewing and digestion and sleeping. So there's simple functional medicine based on lifestyle strategies that you can start implementing right away. And it's not perfect. Nothing is perfect, but it gives you something to start with. And I know most of you on here are looking to start. So take those four C's, implement them today. It's available. The information is available at drkristinabosnar.com. You can download your free guide. You can book a session if you're interested. The information is there as well. You can send this to someone, myname.com. And then how can I help otherwise? Try and incorporate these simple changes. If you don't see significant changes in your resolution with bloating or indigestion or anything that's irritating you based on these simple strategies, then it's time to take a look deeper. So going to Bosnar Health and looking at what functional medicine is like, bosnarhealth.com, what kind of testing we can do, looking at downloading that digestive, six overlooked causes of digestive disorders, and taking a look at that, seeing if something resonates for you there. There's a load of information here for you, just waiting for you to pick up and help yourself. Thank you so much for being here. Let me just see if there's any questions. Could you please, number one, do the lost sound? Oh, were you able to get the sound now? The hypochlorhydria? There will be a replay and it should have this on that. Um, and it'll be sent to all of you that registered. Let me just see if there's anything else. Any other questions? No? Well, I appreciate you coming out here, spread the information, and I look forward to seeing you at my next Ask Dr. Kristina Bosnar. Great to see you. Bye-bye.